And today we are providing them a way to incrementally get more students back into the classroom.
Well, good afternoon, everyone. Thanks for joining us on KREM 2 News First at 4. I'm Tom Sherry.
And I'm Regina. On Whitney is off. Let's get started with breaking news. Today, Governor Jay Inslee issued new guidance for how Washington schools can return to more in-person instruction, and the new recommendations lower the threshold for when students could return to in-person instruction. Now, under these new recommendations, school districts can bring all students into the classroom when there are less than 50 cases per 100,000 people in that district's county. When cases are greater than 50 but less than 350 per 100,000 people, districts are able to start phasing back in-person learning.
So it would start with elementary and middle school students. In counties with cases greater than 350 per 100,000 people, elementary students and those with the highest needs are allowed to be back in the classroom, but they must be in small groups of 15 students or less.
But we're confident that these risks are reasonable, again, as long as we adhere to health and safety measures, like wearing masks, maintaining 6 feet of physical distance, increasing cleaning and improved ventilation.
Well, today the governor also announced he is allocating $3 million in CARES Act funding toward implementing health and safety measures in schools.
So now we're bringing you an update on the Pfizer vaccine distribution in Spokane. Spokane Regional Health District saying 3,900 Pfizer COVID-19 vaccines are allocated to the entire county. The bulk of those doses will go to the region's major hospitals, and today Providence Health confirmed they received doses of the vaccine, and starting Friday they will be giving the vaccine to high-risk caregivers. High-risk caregivers include caregivers in the emergency department, ICU, and respiratory therapists. And according to a spokesperson from Providence, the first shipment of doses are not enough to cover all of its high-risk caregivers, but they are confident in future supplies. And today MultiCare confirmed they will receive a shipment next week. They couldn't give specifics on time or dosage numbers. Both organizations also confirming none of the vaccines will be available to the general public.
As of right now, because it's so limited, it's not extremely something that we're advertising where the vaccine is, because it is within a controlled, organized fashion that these individuals are being vaccinated. So as it starts becoming more open to the public, there will be some more guidance and more visibility on where you can get that information.
And vaccines will soon be available in North Idaho as well. The Panhandle Health District says it's expecting to receive its first shipment of that Pfizer vaccine by the end of this week.
KREM 2's Taylor Vito breaks down how many doses will arrive in North Idaho and who will get them.
So it's really exciting. It's history in the making.
Even as daily coronavirus cases continue to stay high in North Idaho, there is optimism tonight. Vaccines will soon be available to some healthcare workers in the Panhandle.
These are the people on the front lines who absolutely need to receive the vaccines.
The Panhandle Health District, which encompasses Idaho's 5 northern counties, says they're expecting to get their first shipment of the Pfizer COVID-19 vaccine by the end of the week. Altogether, that's nearly 2,000 doses headed to North Idaho, and it accounts for about 14% of Idaho's allotment of the vaccine. But of the shipment heading to the Panhandle Health District, more than half of those doses will head to Kootenai Health alone. This as the hospital this week began restricting certain visitors in an effort to slow the spread of the virus. Now, the health district also polled other healthcare providers across North Idaho, asking them what their vaccine need was like.
And we hope that our community will be open to receiving this vaccine.
It's no secret that handling Pfizer's vaccine has its own challenges, but Panhandle Health says they've made partnerships to have dry ice on hand to help store the vaccines.
Logistically, it's a lot, and we're getting new information. It seems like every hour, but it is exciting. I mean, we're kind of seeing the light at the end of the tunnel, maybe.
The health district said they were initially expecting their shipment to arrive on Thursday, but that's since been pushed back to Friday. Taylor Vito, KREM 2 News.
And we have more good news on the vaccine front. The FDA says that Moderna's vaccine is highly effective and it appears to be on track for the same emergency use authorization that Pfizer received last week. So new data released by the FDA confirms that Moderna's vaccine is more than 94% effective in preventing COVID-19. And unlike the Pfizer vaccine, Moderna's can be stored at normal refrigerator temperatures for up to 30 days. So that should make it easier to get the vaccine to rural communities. And meanwhile, people who need to get tested for COVID-19 could soon have the option to take a test at home. Yeah, today the FDA approved the first at-home test kit. Anyone 2 years old and up can use it even if you aren't showing symptoms. The FDA tweeted the test uses a nasal swab to check for proteins of the virus. You can then use an app on your smartphone to get your results. The kit costs about $30 and the test is around 96% accurate. The FDA says you could get your results in as little as 20 minutes. Now that it's got approval, the drugstores can now begin to sell them to anyone who wants them. However, the FDA also says that patients could get a false negative or even a false positive. If you test positive, you should self-isolate and get care from your healthcare provider. And if you test negative, still a good idea to check in with a doctor and get another test. So we know that this is a whole lot of information about that new COVID-19 vaccine.
And that's why here at KREM, we created the vaccine team. Do you have a vaccine question that you'd like to ask them? Well, you can text us your question at 509-448-2000.
And for the latest vaccine updates so that you can stay up to speed, just text the word vaccine to that same phone number and we'll send a link right to your phone.
All right, Tom, so I have to say it's not 75 degrees out there, but it's
trying
warm.
to get their attention up in the booth. I think we stuck that sensor is up on our roof here at KREM Television, and I suspect we somehow or another got pushed over next to a vent or something.
Maybe,
but
it is a lot warmer today though than yesterday.
Well, it's not 75, but we'll take 38, right? It is above freezing, as you can see. My gosh, 38 degrees, winds out of the east right now at 9 miles per hour. Beautiful downtown. We've got rain headed our way though, and it will just be in the form of rain, at least locally here in Spokane. The green indicates the rain. Seeing snow though, falling in the Cascades and some of the valleys north of us, Regina, will see snow. So rain and snow this evening, chance of rain or wet snow overnight with a low of 34. It's going to be windy tomorrow with gusts to 25 miles an hour, and I'm expecting mostly rain with a daytime high expected of 41. Looking ahead to the weekend, look at those temperatures. Almost 50 degrees on Sunday, and it will be wet and windy, and it looks like it's going to be rain instead of snow. Keep in mind the average daytime high for this time of year is really only 32 degrees, and we're looking for a high of 48 on Sunday.
I know a lot of people are happy about that, so there you
Some
go.
people are happy about it. Other folks, saying,
Want
hey,
the snow.
want the snow.
Yeah.
White Christmas, and I hear you.
We're hoping for that.
You bet.